Sleeve gastrectomy is a surgical technique that allows patients to eat less and drink less by removing approximately 70 to 80% of the stomach. The purpose of this surgery is reduce the amount of edible and drinkable foods. In addition to this effect, also a hormonal effect is shown due to the sleeve gastrectomy related to decrease in the hunger-related hormones. The patients with a body mass index higher than 35 can be performed sleeve gastrectomy. Like almost all bariatric surgeries, sleeve gastrectomy is also performed laparoscopically. In laparoscopy technique, we put 4 to 5 holes in the abdominal wall and insufflate air inside. First, the stomach is freed from the surrounding tissues. Then we use special instruments to stitch and cut the stomach. In this surgery, approximately 70 to 80% of the stomach is removed. Patient will have a new stomach that has a volume of 200 cc almost. The operation time lasts 30 to 45 minutes. Considering the preoperative preparations and postoperative follow-up in the operating room, it can take 2 hours all. Weight regain is possible in a limited group of patients after all bariatric surgeries. This is also true for sleeve gastrectomy. We shouldn't forget that these surgeries are not miracles. They are a good starter and helper for weight loss. In order to prevent weight regain is never seen in patients who have regulated nutrition, learned the concept of protein, and exercise routinely after surgery. The usage rates of gastric bands decreased below 1% today. Long-term displacement problems, nausea and vomiting problems are among the leading dissatisfaction with bands. Patients with a dissatisfaction of bands and weight regain can be evaluated and performed a revisional surgery. The revision technique can be a sleeve gastrectomy or an appropriate gastric bypass technique. In our clinic, we perform all these revisional surgeries with a high success rate. Today, sleeve gastrectomy is the most applied bariatric surgery technique in all around the world. After the surgery, it is possible to reach ideal weight in the first year, and almost 70 to 80% of the excess weight is lost in the first 6 to 8 months after sleeve gastrectomy. We can state that the most important advantage of sleeve gastrectomy is that it is an anatomical operation. In other words, the anatomy of digestive system changes minimally compared to other techniques. This provides a rapid recovery and rapid adaptation. Other advantages can be counted as less exposure to anesthesia due to a short surgery time and less complication rates with experienced team. The most important disadvantage of sleeve gastrectomy is increasing of the acidic reflux. For this reason, we consider alternative techniques in patients with severe reflux. Sleeve gastrectomy surgery is a restrictive surgery management, while gastric bypass has a restrictive and malabsorptive management technique. Sleeve gastrectomy is technically easier and the operation time is shorter. Partially, it involves less risk of complication and patient adaptation and recovery is faster. In bypass surgery, the likelihood of complication is slightly higher. Due to the duration of the operation, the exposure of the patients for anesthesia is higher. And we should know that when a revision is required, the possibility is lower in gastric bypass. However, the effect on weight loss of both surgeries is similar. In all bariatric surgeries, the adaptation of the patient to nutrition is the most important part. The patient has a new stomach even smaller than before. After the surgery, we are planning a step-by-step nutrition. In the first 2 weeks, all the patients take only liquid diets and protein shakes, and the following 2 weeks, they are given a list including pure diet, and after the first month, the solid foods are started. All these periods are closely followed by our nutritionists. One of the most important nutritional rules is to drink enough water in all the periods. Revision means to change something that has been changed before. Reoperation of a patient is called revisional surgery due to insufficient weight loss or weight regain or other problems related to first surgery. In presence of these reasons, sleeve gastrectomy can also be revised. In the revision of sleeve gastrectomy, a sleeve gastrectomy can be performed again or other bypass techniques can be performed for a new surgery. Of course, in this kind of surgeries, all the patients should be informed and the most permanent technique should be selected according to the patient. We observe a rapid recovery process after sleeve gastrectomy that we performed in our clinic. Good pain control, controlling of nausea and vomiting, and rapid mobilizations are factors that accelerate recovery. We can say that these parameters are the most important things in our clinic. In addition, we observe our patients for 3 days in the hospital. In this 3 days, if all the laboratory tests and nutrition and the mobilization of the patients is okay, they can be discharged from the hospital. Our patients who have a good hospital process leave the hospital in a way that they can easily return to their daily activities. In sleeve gastrectomy procedure, we perform thrombosis and antibiotic prophylaxis before the surgery. We also give short course of antibiotics when the patients are discharged. In order to suppress the acid levels in the stomach, we recommend stomach protectors for 3 months to all patients. In addition, we recommend vitamin supplements for the first 3 to 6 months. When the patients are discharged, blood thinners for 10 days and painkillers when they are needed also recommended after sleeve gastrectomy. We evaluate all our patients in terms of anesthesia risks before surgery. These assessments include a review of all systems. Liver function tests, kidney function tests, thyroid function tests, and other blood analyses are performed. A chest X-ray and an electrocardiogram is performed to evaluate respiratory problems and heart rhythm problems. By all the results, we consultate all the patients to internal medicine and anesthesia departments. After consultations, we carry out additional tests if necessary. In addition to this, preoperative abdominal ultrasonographic examination and endoscopic evaluation are also performed to all our patients.